Fast facts. Understanding the different mechanisms of action of overactive bladder (OAB) treatments. Today you will learn the two classes of pharmacologic therapy approved for OAB and their mechanisms of action. Important considerations regarding the use of both therapies in older adults. There are two distinct classes of pharmacologic therapy approved for the treatment of OAB symptoms. These agents include anticholinergics and beta-3 adrenergic receptor agonists, which target parasympathetic and sympathetic pathways. Anticholinergics inhibit binding of acetylcholine to muscarinic receptors in the bladder, which suppresses detrusor muscle contractions and delays the desire to empty the bladder. Beta-3 adrenergic receptor agonists activate beta-3 adrenergic receptors, relaxing detrusor smooth muscle and increasing bladder storage capacity. Current guidelines include warnings about the use of certain drugs and pharmacologic management in older adults. Of note, in the 2023 AGS Beers criteria, anticholinergic drugs are included among the classes of potentially clinically important drug-drug interactions that should be avoided in older adults. The rationale for this recommendation specifies an increased risk of cognitive decline. Because of this, the Beers criteria include a strong recommendation to avoid use or minimize the number of acetylcholine drugs. The American Urological Association recommends to use caution with beta-3 adrenergic receptor agonists in patients with problems with cardiovascular function, including hypertension, heart rate, and cardiac arrhythmias. In summary, there are two classes of pharmacologic therapy approved for OAB. These include anticholinergics and beta-3 adrenergic agonists. Anticholinergics inhibit the binding of acetylcholine to muscarinic receptors in the bladder, which suppresses detrusor muscle contractions and delays bladder emptying. Beta-3 adrenergic receptor agonists activate beta-3 adrenergic receptors, relaxing detrusor smooth muscle and increasing bladder capacity. There are several important considerations to keep in mind when treating OAB in older adults, including side effects and adverse reactions. The American Geriatric Society recommends avoiding or minimizing the number of anticholinergic drugs in older patients due to the increased risk of cognitive decline. The American Urological Association recommends to use caution with beta-3 adrenergic receptor agonists in patients with problems with cardiovascular function, including hypertension, heart rate, and cardiac arrhythmias. How do you decide which pharmacotherapy to prescribe?